Can we really expect the estimated 45,000 psychiatrists in the United States to treat the mental health needs of the entire country? That equates to about 135 psychiatrists per 1 million people. These numbers are troubling and illustrate the country's severe shortage of mental and behavioral health professionals. To combat these egregious mental health shortages, more of these professionals need to be trained so they can enter into the workforce. However, training and recruiting in an adequate amount of time to help those struggling is a large task. These aspiring professionals would need to possibly spend years getting the training and education needed to receive an occupational license that would permit them to practice in their desired mental or behavioral health profession. Additionally, once these professionals enter into the workforce, the cost of their services is often too high for many to afford. To effectively combat shortages of mental and behavioral health professionals, and to supplement the training and hiring of traditional professionals, Utah and the rest of the country might look to countries with even worse shortages for answers. Now, while this may sound counterintuitive, these countries are finding creative ways to combat their shortages, and we should be taking notes. Community-based care is one of these innovative solutions. In community-based healthcare, a community's laypeople with less training provide short-term mental health interventions in community location centers like parks or homes. Community-based care has been touted as an avenue to effectively treat mental health problems for large swaths of people because it emphasizes cultural context and because it offers lower barriers to entry compared to traditional occupational licensing for those interested in joining a mental health profession. This model is also inexpensive to operate, easy to scale, and incredibly effective. Friendship Bench, which is a nonprofit, can illustrate some of the benefits that community-based care provides. This nonprofit recruits middle-aged and older women and teaches them how to identify and treat depression and anxiety using problem-solving therapy, which helps individuals acquire the skills to create solutions to the issues they may experience. Since the organization's inception, more than 1,600 individuals have received training and 158,000 people have received services. The care received by participants has been effective, as illustrated by a 2016 study. During this study, patients were assigned to either receive treatment via Friendship Bench or receive care through standard psychiatric avenues. After 6 months, 14% of those who utilized Friendship Bench were still depressed, compared to 50% of those in the standard care group. Strong Minds trains laypeople to lead group talk therapy sessions as a way to treat women with depression. It is estimated that the treatment Strong Minds provides, at a cost of $248, is so effective that it may prevent a year of severe major depressive disorder. It is important to note that community-based care professionals should not replace psychiatrists and should be primarily used to treat mild cases of common disorders. Practitioners of these approaches should act only within the scope of their practice and cultivate relationships with other mental health professionals so that they may easily refer patients that fall outside of their expertise. Various states are promoting community-based care to address the mental health gap by reaching people who can't afford to pay for a licensed professional, with a focus on serving Black people, Indigenous people, and other people of color. Some of these programs are already being adopted within the United States. For example, Friendship Bench has made its way to New York City, Strong Minds is setting up a pilot program in New Jersey, and other states are looking at additional nonprofit avenues. Utah should be the next state to explore these innovative and effective treatment options, and Utah's lawmakers should explore ways to deregulate barriers to this treatment option via avenues such as occupational licensing reform.